Hi, my name is Han Nguyen, and I will be presenting our project entitled Machine Learning to Automate Clinician and Design Empirical Manual for Congenital Heart Disease Identification in Large Claims Databases. Congenital heart disease is an umbrella term for the numerous heart defects acquired at birth. Patients with congenital heart disease are surviving longer into adulthood thanks to the advances of medicine. This longer survival, along with the increased number of patients, allows for better research in this patient population. Large claims databases are an excellent source of research data as they provide very large samples with little to no referral bias. The first step and challenge in using them in congenital heart disease research is the ability to identify true congenital heart disease patients, as opposed to patients who have a diagnosis of congenital heart disease in their file but who don't actually have the disease. In fact, congenital heart disease is a very complex diagnosis to make, as it has 25 possible lesions with varying degree of severity. So the correct diagnosis requires extensive and time-consuming manual chart review. To try to solve this problem, we sought to develop machine learning algorithms capable of extracting true congenital heart disease patients from 3 large administrative and healthcare databases in Quebec, Canada, and compare its performance to a clinician-developed algorithm. 19,187 patients with at least one diagnosis of congenital heart disease made by a non-cardiovascular specialist between the years 1983 and 2000 were reviewed. Of these, 3,784 patients were previously identified through manual audits as true congenital heart disease patients. We submitted the study population to 2 prediction models, a conventional logistic regression on the one hand, and machine learning models to evaluate their performance on identifying true congenital heart disease patients. The machine learning arm was further subdivided into a training set and a test set. Using supervised learning, we trained 2 machine learning models, namely gradient boosting decision tree and support vector machine with the training data set using a binary outcome, yes congenital heart disease and no congenital heart disease. 82 features were used to construct the models. The results were that gradient boosting decision tree followed by support vector machine outperformed conventional logistic regression in correct identification of congenital heart disease patients with both accuracy, sensitivity, and specificity. We then externally validated the gradient boosting decision tree with a much larger sample of 68,000 patients, and this showed maintenance of the excellent accuracy. Thus, we showed that machine learning algorithms have the potential to extract the correct diagnosis of a complex disease from a large administrative database in an automated and accurate way, saving the physician time and energy. Thank you.